Hello, so this is birth control options. Choosing a method of birth control can be difficult. Know the options and how to pick the type of contraception that's right for you. If you're considering using birth control contraception, you have a variety of options. To help pick the right method for birth control for you and your partner, consider the following questions. What birth control options are available? Your birth control options include barrier methods, which include male and female condoms, as well as a diaphragm, cervical cap, contraceptive sponge, short-acting hormonal methods. Examples of this are birth control pills, as well as vaginal ring, skin patch, and contraceptive injection. These are considered short-acting methods because you have to remember to use them daily, weekly, or monthly basis. Long-acting hormonal methods. Examples include copper IUD, the hormonal IUD, and the contraceptive implant Nexaplan. These are considered long-acting methods because they last for 3 to 10 years after insertion, depending on the device, or until you decide to have this device removed. Sterilization. This is a permanent method of birth control. Examples include tubal ligation for women and vasectomy for men. Fertility awareness method. These methods focus on knowing which days of the month you are able to get pregnant, which ones you're not. To avoid getting pregnant, you do not have to have sex on around the days that you are fertile, or use a barrier method of birth control. It's also important to be aware of emergency contraceptives, such as morning after pill, which can be used to prevent pregnancy and unprotected sex. How do different birth control options work? Various types of birth control works in different ways. Birth control methods may prevent sperm from reaching the egg, inactivate or damage the sperm, prevent an egg from being released each month. After the lining of the uterus, alter the lining of the uterus so that a fertilized egg doesn't attach to it, thicken cervical mucus so that sperm can't easily pass through it. What is the method's effectiveness? To be effective, any method of contraception must be used consistently and correctly. Contraceptions that require little effort on your part, such as IUDs, contraceptive implants, and sterilization, are associated with lower pregnancy rates. In contrast, methods that require monitoring, virility, or periodic abstinence are associated with higher pregnancy rates. Another question you need to ask is it reversible? The method of contraception you choose depends on your reproductive goals. If you're planning pregnancy in the near future, you may want a method that's easily stopped or quickly reversible, such as short-acting hormonal method or a barrier method. If you want to prevent pregnancy pregnancy for a longer amount of time, you may consider a long-acting method, such as an IUD. If you're certain that you don't want to get pregnant at any time in the future, you may prefer a permanent method, such as sterilization. You may find that different contraception options work for you at different stages in your life. Another question is it convenient and affordable? It's important to choose a type of birth control that suits your lifestyle. For some people, the most convenient form of birth control may be the one that is easy to use, has no bothersome side effects, or does not disrupt the sexual experience. For others, convenience means no prescription is required. So some methods of contraception are inexpensive, while others are more costly. Another question is, what are the side effects? Consider your tolerance for the possible side effects associated with a particular birth control method. Some methods are pose more side effects, some potentially serious. Talk to your doctor about your medical history and how it might affect your choice of birth control. And over here is the 13 most common side effects of the pills. So, does it offer other benefits? In addition to preventing pregnancy, some contraceptives provide benefits such as more predictability, lighter menstrual cycles, a decreased risk of sexually transmitted infections, or a reduction in the risk of some cancers. Is it accessible to your sexual partner? Your partner may have birth control preferences that are similar to or different from your own. Discuss birth control options with your partner to help determine which method is acceptable to both of you. So what's the bottom line? The best method for birth control for you is one that is safe, that you are comfortable using, and that you are able to use consistently and correctly. Your preferred method of birth control may change over your lifetime and is influenced by many factors, including your age, your health history, your reproductive goals, relationship factors, religious beliefs, differences between birth control methods, including how effective they are at preventing pregnancy. Knowing your options is definitely part of the decision process, but an honest assessment of yourself and your relationships is just as important when deciding which type of birth control is right for you.